What is the recovery time for implant removal?
If the implant is above the muscle, relatively smoother, nicer, better recovery. If it's below the muscle, it is going to be longer. Now, there are so many variables. Now, the many variables come into play are how good was your surgeon? Was he board certified? Was the implant above the muscle or below? Did you get chemo radiation if you were a cancer patient? Did you get alloderm cadaveric skin or not? If that was used in reconstruction. If you had 800cc implant or 175cc implant. If you had multiple surgeries done. Another patient that is heavy, BMI of 40, her recovery is very different from the young 35-year-old patient who has a 18 BMI. A patient who is a smoker, so she just could not stop smoking. Her recovery is going to be different. Someone who is non-compliant and moving her arms 2-3 weeks out, her recovery is going to be very different than the other person who's been extremely careful, hands and arms tied. Now, someone who has a ruptured implant, someone who has capsular contracture, someone who has a biofilm, someone who basically has had good reconstruction, excellent results, but now because of the malposition effect, now the one side is different compared to the other. And I can come up with 10 more different scenarios. And the point I'm trying to make here is you cannot extrapolate one patient to the next. So when it comes to recovery, it's a very broad term, but within 6, 7, 8 days, I will say 80-90% of my patients are driving because they're off the pain meds, their reaction time is good, and they have the confidence in driving. So there are a lot of factors that come into play. And remember, the moment you got your muscle cut to get the implants below the muscle was compromised.